Chapter 17 discusses nutritional support. There are a variety of different reasons that patients engage or have to have the need for supplementing their nutrients. Nutrients is very important for cellular growth, cellular function, enzyme activity, carbohydrate, fat, and protein synthesis, muscular contraction, and wound healing. It's also very important for immune competence as well as GI integrity. Inadequate nutrition intake can result from surgery, trauma, malignancy, and other catabolic illnesses. Without adequate nutrition, protein catabolism takes place. Malnutrition as well as diminished organ function will affect the GI, hepatic, renal, cardiac, and respiratory functioning. The functioning of the immune system is also decreased. There are two different routes for administering nutritional support: enteral and parenteral. Enteral nutrition involves the GI tract and can be given orally or by feeding tubes or tube feedings. If the patient can swallow, nutrient preparations can be taken by mouth. If the patient is unable to swallow, a tube is inserted into the stomach or small intestines. If you look at the illustration here, you can see there are several different routes in regards to a patient receiving enteral feedings. They can either receive it via the nasogastric route, nasoduodenal route, nasojejunal route. They can get a G-tube or gastrostomy or jejunostomy. It's another process in regards to how patients can receive enteral feedings. Enteral feeding solutions can come in a variety of different ways. These solutions differ according to the various nutrients, caloric values, and osmolality. The three groups of solutions for enteral nutrition are blenderized, polymetric, and elemental or monometric type of solutions. The blended formulas are enteral feedings for liquids in continuous, so they are able to pass through the tube. These are individually prepared based on the patient's nutritional needs. The two groups of polymetric solutions are milk based on lactose-free. Most milk-based polymetric preparations come in powder form to be mixed with milk or water. Examples of polymetric solutions include Ensure, Isocal, or Osmolite, are different types of solutions that can be present with our patients. Please refer to Table 17-1 in your book on page 245 to get examples of the three different types of formulas. Elemental or monometric type of solutions contain partially digest nutrients for feedings and contains nitrogen, carbohydrates, and minimal fats, and are used for various intestinal diseases. There are several methods for delivery of enteral feedings. Bolus is one of the first methods that's usually present for the patient. It's about 250 to 400 ml of solution that's administered rapidly through a syringe or by gravity through a funneled tube itself. It's usually about 4 to 6 times a day and takes about 10 minutes in order for the feeding to be administered to the patient. Patients may not be able to tolerate the fluids and cause them to have severe abdominal cramping, diarrhea, nausea and vomiting, and can aspirate from the very rapid infusion of the solution. However, it is usually a method that's reserved for ambulatory type of patients. If we consider intermittent enteral feedings, this administration process is usually every 3 to 6 hours and can usually take between 30 to 60 minutes to infuse. The patients are usually given feedings through a bag and basically would be considered the most inexpensive method of administering enteral feedings. When we consider continuous feedings, it is usually for critically ill patients. It is going directly into the small intestine and will require an infusion pump such as a kangaroo pump. The rate of infusion is usually over 24 hours, so it's continuous and usually begins from 50 to 125 milliliters per hour. Cyclic method is another method of infusion. This is usually the most greatest risk for aspiration. It's something that usually is administered to the patient day or night over a 8 to 16 hour time frame. It's usually recommended for the patient to have it at night, which allows the patient freedom throughout the day to do whatever daily activities that they would like to engage in. There are several different complications that could be presented with nutritional support, which can result in dehydration due to the fact of insufficient amount of water that's given to the patients with the feedings or between the feedings. Aspiration pneumonitis is a major complication because the patient can develop aspirated pneumonia. What is usually recommended is that the head of the bed is up or elevated between 30 to 45 degrees. It's important for us to do residual checks for the patient every 4 hours between the feedings to make sure that the medication or feeding is being absorbed properly by the small intestines. One of the major problems of enteral feedings is diarrhea. This could be caused by the rapid administrations of the fluids, the high caloric solution, and just malnutrition and GI bacteria. C. diff is very common whenever patients are on tube feedings. Antibacterial agents and drugs that contain magnesium, sorbitol, are associated with the occurrence of diarrhea as well. So many oral liquid drugs are hyperosmolar and tend to pull water into the GI tract and cause diarrhea of the patients. So it's very important for us to make sure that we're monitoring the patient's enteral nutrition. And the recommended parameters for monitoring includes blood chemistries. We always want to look at the patient's BUN and creatinine levels, as well as all of the electrolytes when we're going to be constantly monitoring the patient's glucose levels, triglycerides, proteins, maintaining the INO, and weight of the patients as well. Very important whenever you're going to be considering this type of method of infusion. Enteral safety is key when we are caring for our patients. So the acronym ALERT is usually something that we want to make sure that we take into consideration and has become a campaign to promote safe tube feedings. A stands for aseptic technique. Always make sure that we're following aseptic technique. Make sure that the formula is the right formula for the patient. It's being delivered in a proper procedure. We have good hand washing. We wear gloves. We handle the tube feedings and avoid touching the can tops and container openings when we're spiking the bags or spiking the ports themselves. We want to label the enteral feedings themselves. Label with the patient's name, the formula, the rate of infusion, the date and time, and make sure all of the equipment is changed within 24 hours. The medication has to be, is only good for a 24-hour period to eliminate the risk of bacteria growing in the particular feedings. If we want to elevate our patient's heads at 30 degrees, this is recommended because It might help to migrate the risk of reflux and aspirations from the gastric contents that could be present for our patients. R is for the right patient, right formula, right tubing. Always match the formula with the doctor's order. Always make sure we verify the tubing, and always connect the formula to the container so that it is the correct feeding tube for the patients. T is for tracing all the lines and tubing back to the patient. You want to make sure that you avoid any misconnections. Trace all the tubes back and all the lines from origin to the patient. Only integral to integral connections. This is very important when we're going to be administering any type of integral solutions for our patients. Integral medications are usually given to patients to help promote digestion and absorption of foods normally accomplished by natural amylase and lipase and protease. They're best given before meals. These artificial enzymes promote digestion and absorption of foods. Pancreatic enzymes such as pancreatin, creon, and pancreolipase, viacase, are products used by individuals with pancreatic enzyme deficiencies resulting from conditions such as pancreatectomy, pancreatic obstruction, and cystic fibrosis. Most of these drugs can be administered orally, but also be given via the enteral tube. The drug must be in liquid form or dissolved into a liquid. Drugs that cannot be dissolved are time-released forms, enteral-coated forms, sublingual forms, and bulk-forming laxatives. As you can see, the nursing process plays a key role in everything that we do. So please refer to page 247 in your book as well as page 248 to understand how that nursing process is implemented when caring for patients who have enteral nutrition. Parenteral nutrition involves administering high caloric nutrients through large veins, for example, the subclavian vein. This method is called total parenteral nutrition, hyperalimentation, or intravenous hyperalimentation. Parenteral nutrition is more costly than enteral nutrition, and the benefits are not significant. In fact, with TPN, there is a higher infection rate than with enteral nutrition. The use of TPN does not promote effective GI integrity, hepatic function, or body weight gain as enteral nutrition does. Enteral feedings require a functioning GI tract. TPN becomes necessary when the GI tract is incapacitated due to uncontrolled vomiting, malabsorption, or intestinal obstruction. TPN is the primary method for providing complete nutrients by the parenteral or IV route. TPN is an infusion of hyperosmolar glucose, amino acids, vitamins, electrolytes, minerals, and trace elements. It can meet all a patient's total nutritional needs. TPN is indicated for patients with severe burns who are in negative nitrogen balance, patients with GI disorders whose GI tract needs a complete rest, patients with absorption problems such as pancreatitis, Crohn's disease, and ulcerative colitis, and these patients with debilitating diseases such as metastatic cancer or acquired immunodeficiency syndrome, known as AIDS. The nurse must be familiar with the specific equipment used in caring for the patient with a TPN. A variety of setups are available for administration. Some tubings have anti-reflux valves and others have clamps. Each has implications for the administration of medication. Parenteral preparation must be administered by infusion pump to ensure accurate flow rate. Management of patients requiring parenteral and enteral nutrition is best accomplished by an interdisciplinary team, including a nurse, a physician, dietitian, as well as a pharmacy. Policies and procedures for TPN therapy may vary by region and institution for research and followed accordingly. It's very important for nurses to make sure that we administer the medications to prevent the least complications for our patients. It is essential to make sure that complications associated with TPN can be assessed and monitored. But these complications could also result from a catheter insertion and TPN infusion. For example, to prevent an air embolism, all central lines should have a slide clamp on them to be closed completely when the solution bag and tubings are changed. Strict aseptic or asepsis is necessary when changing all of the IV tubings and dressings at the insertion sites. Gloves, masks, antibacterial ointments are usually necessary. TPN solution is an excellent medium for organisms to grow. This is a hypertonic dextrose and a protein hydrolysate solution which promotes yeast and bacterial growth. It has been reported that these organisms do not grow as rapidly in preferred crystalline amino acid solutions as they do in a protein hydrolysate solution. It's important for us to make sure that it is refrigerated and prepared in a prepared solution. We have to administer the medication within a 24-hour period, but what nurses need to make sure that we pay attention to is that the medication is administered at room temperature. We do not want to alter the patient's or cause the patient to go into a hypothermic type of situation. It is important for us to make sure that we monitor what the solution says and compare it with the doctor's order prior to administering the medication. And any type of sudden interruption in a TPN therapy can cause our patients to go into hypoglycemia. If for some reason we're not able to obtain the solution from pharmacy in a sufficient amount of time, it's important for us to make sure that we have a hypertonic dextrose solution of 20% or greater available to administer to our patients. So D10 should be readily available or take the place if the TPN solution is still being prepared by pharmacy. Another thing that we need to make sure that we're paying attention to is that you are constantly monitoring the patient's blood sugar. We want to make sure that we monitor the patients because of the fact that it has a high glucose intake or high capability of causing the patients to be either hypoglycemic or hypoglycemic. We want to make sure that we monitor the infusion rate. We're also monitoring the patient's electrolytes to make sure that we understand if there's going to be any alterations in that as well. Because this medication can cause infection, we want to make sure that we assess the patient's site for contamination, and we want to assess the patients for any signs and symptoms of infection as well. If we're thinking of, when we go back to the catheter insertion, anytime you put a central line into a patient, it puts them at risk for pneumothorax, a hemothorax, or a hydrothorax because of the fluids that can definitely be infused into the chest wall. So all those things we need to make sure we're assessing for sharp pain that might be present to the patient and a decrease into the breath sounds. So it is essential for us to make sure that once again we assess the patient. We're constantly checking to see if there's signs and symptoms of infection or phlebitis. We're also making sure that we change the dressing for the patient and we follow what the hospital's protocol may be, because in some facilities it may be 48 to 78 hours, and it will vary when the dressings need to be changed in the institution. However, the tubing must be changed every 24 hours, just like it was done with the patients that are taking these enteral feedings as well. So it is ideal and important for us to make sure that we are assessing the patient for any types of signs and symptoms of fluid volume overload. Once again, the nursing process plays an integral part in how we care for our patients. If we are to make sure that we are providing patient-centered care, we're to implement the nursing process. With that, refer to page 249 and 250 in your text so that you can evaluate what processes should be taken for a patient whenever we're using or implementing the nursing process.